He
All right.
wants to go. Okay, yeah. What is the most appropriate treatment for this patient? Glucose naloxone, prednisone, potassium supplementation, or acyclovir. So, a 23-year-old woman, she comes to the ED with a severe abdominal pain, nausea, vomiting. Also complains of muscle weakness in her arms and legs. Her medical history is significant for recurrent abdominal pain and anxiety. Vital signs are stable. Her physical exam is unremarkable, except for mild abdominal tenderness. Laboratory tests reveal a normal CBC and serum electrolytes, but a urinalysis demonstrate elevated levels of porphobilinogen, most appropriate treatment. So this guy or this lady has acute intermittent porphyrias, with the abdominal pain. And then, of course, the most specific thing in this stem is the urinalysis showing porphobilinogen. And what's the most appropriate treatment for this person? Glucose? I don't I don't think you would give them glucose. I mean, I'll leave it. Like I'm not too sure.
Okay.
Ivy naloxone. No, she doesn't have opioid. Prednisone. I don't think so. I mean, I'm definitely gonna rule out B and E. I'm definitely gonna rule out acyclovir. Acute intermittent porphyria. So I'm gonna try to think back to like the pathophysiology of this. It's like some defect in heme synthesis that leads to accumulation of like aminolevulinic acid or something like that. I can't remember the specifics, but I don't know. I mean, she has, let's go back to her chief complaint, abdominal pain, nausea, vomiting. Yeah, that's like, but she also complains of muscle weakness. Like maybe she has hypokalemia. I don't know how that would be caused by AIP.
Yeah, this one's tough. I'm not exactly sure.
I'll just go with the potassium just because she has the muscle weakness.
Okay, so let's look. I wasn't sure here. Let's see. Severe abdominal pain, weakness, elevated pain, which acute porphyria attack. Acute porphyria attacks are a group of inherited muscle defects in heme synthesis. IV glucose first line treatment as it helps suppress heme synthesis and alleviate symptoms. So I wouldn't have known that. I didn't know that for sure. But that seems to be the best answer. And IV potassium supplementation, I think it's a good answer. Except there's one thing that I would say. Kind of leads you away towards that is that lab test showed normal CBC and serum.
Oh yeah.
So that wouldn't be, something on your top, right? Opioid, right? Reduction, right? You know, that's not going to help. Treat inflammatory autoimmune disorders for prednisone, but not acute porphyria attacks, right? Potassium, like I said, serum electrolytes are fine. And then acyclovir, that has nothing to do. We're not dealing with any kind of viruses here. So just kind of working through that. That's a little bit tougher of a question, but you got the diagnosis correct. It's acute porphyria attack. And then you have to figure out, okay, we don't really talk about next steps in management for that, but it seems like IV glucose is going to help suppress that kind of heme pathway. So